Most people in the UK affected by rare diseases face multiple challenges, from getting an accurate diagnosis to accessing treatment. Sanofi, one of the world's largest healthcare companies, is working hard to change that.
As Dominic's mother and head of market access for the UK and Ireland at Sanofi, Fleur Chandler represents families struggling to live with rare diseases.
My whole career has been around ensuring that patients in the UK can get access to medicines by trying to demonstrate the value of those medicines. And while working at Sanofi, I can really continue to do that and also bring my personal experience now into my professional life.
Dominic is 15 and living with Duchenne muscular dystrophy, a disabling genetic condition. His muscles, including his heart, get progressively weaker, and he's been in a wheelchair since he was 10. The disease is terminal.
The word fatal is very difficult to comprehend, and in something like Duchenne it's so slow that you know that it's coming, and I know that I will outlive my son, and that's very difficult because I think that puts you into a sort of low level of depression in a constant way.
Families such as Fleur's have the additional burden of knowing that most research tends to centre on diseases that affect large numbers of people. However, Sanofi have a history of work on rare diseases stretching back more than 30 years.
As a result of the work being carried out by companies like Sanofi and better management of the complications that can arise from rare diseases, life expectancy is increasing, and young adults have a family and careers, with some surviving into their 30s and even their 40s.
Shortening the time frame from the first sign of symptoms to diagnosis and then treatment can make a huge difference.
We believe that there are three areas that we need to partner in and collaborate in. The first is the use of big data to find the undiagnosed patients. The second is around diagnostic testing and the infrastructure that's set up for that. And then the third is around rapid and sustainable access to therapies.
The issue with rare diseases, obviously there's so many rare diseases, and individually they're very, very rare, but collectively it's actually quite common to have a rare disease.
Dr. James Lineker believes more specialised research is needed to help patients with rare diseases.
I think we have to focus more on each individual rare disease. I think we have to focus on screening for these diseases. And once we've found treatments that work, it's a case of getting them to the people that need them as soon as possible. And that will really transform the outlook for the lives of patients with these rare conditions.
Harnessing technology is also key to making patients' lives easier and giving them a degree of control.
And I think one thing that technology can do is allow our patients to find each other online and form groups. And most importantly, I think, for many rare diseases where there aren't many treatments, is finding out what research is going on and how they can take part in that.
Lower numbers of patients means less funding, which can make developing treatments difficult. But Sanofi is dedicated to supporting this work.
We continue to work diligently in the R&D teams, both in terms of improvements in the disease areas we work in today, but also on areas where there aren't yet therapies.
But Fleur knows there may never be a medicine to help her son.
The downside of working in the healthcare industry and pharma is that I know that he's past the age where even if any medical miracle happens, it's not going to apply to us. But there is a life to be lived, and it is one that's very much worth living.